Welcome to Gentle Yoga for Back Care. Typically we do this on the yoga mat. I also cue verbally and sometimes demonstrate the chair versions of these postures. But guess what? I have a spicy knee. I don't know if I really want to get down on that knee today. So today's going to be taught from the chair, but I am going to give you the verbal words for getting down and being on the yoga mat. So be that as it may, whatever all that means, I'm going to stand up, move this chair out of the way. I come back up to the front of the room near the end of the class for our gratitude practice, for that guided rest and relaxation. Maybe some energy work if we have time, but I'm going to try to get all those yoga postures in there. I'm going to try for easing back challenges. So yay or not. Let me move this chair out of the way. Somehow, somewhere. I don't want to block everybody's pathway. Is that in the camera? No, it's not. Okay, good. All right, so I'm going to come back to the back of the room, and like I said, you know what? It's really giving me some challenges today, so I am going to have to do the class seated. I know some of y'all just really like that, because then you can go back and look at the video and do the class seated on the chair. So let me make sure where it is in the camera view. Very good. If you're doing this class on the yoga mat, so what you're going to do is go into constructive rest posture, which means, if you can see Vicky in the video, if you have it on multi-view, you're going to be laying on your back with your knees bent with your feet on the yoga mat. That's called constructive rest posture. For those of us seated in the chair, you got to be away from the back of the chair to where you engage those tall posture muscles. And those of us seated in the chair, let's just go ahead and do that little shoulder shuffle here. Breathing in, breathing out, and then relax those shoulders down. So you can place your hands on your belly, one hand low below the belly button, one hand above. Relax those shoulders. We're going to do what's called low belly breathing to help us lessen our stress. So let's breathe in. When we breathe in, the belly expands forward. The chest does too. So let's do that. Breathe in, belly and chest expand. And as you exhale, draw that belly button towards your spine. Relax those shoulders now. Okay, let's do that again. Breathe in, belly out. Big old breath, okay? And then exhale, really contract the belly button towards the spine. Now making a noise in the back of the throat. It's called the Ujjayi breath. I'm trying to be noisy when I breathe. So let's do that again. Breathe in, belly big. And then exhale, belly button towards the spine. One more time. Breathe in, belly big. And exhale. Beautiful. So this is the chair version of a constructive rest posture. For those of you that do not like to get down to the ground, you could do this alternatively on your couch, on your bed, to do what we're doing on the floor, if you so desire. So from here, I'm going to grab my yoga block, my strap. They're, of course, way far away, right? Of course. And it should have been in the email that you need a block and a strap. But you can do this class without the gear. And I do record the class to where if you don't have gear today, you get that recording and get the gear and see what the difference is using gear or not. So our first one we're going to do today is called windshield wipers. So if you're lying on your back, you're going to take one foot and drop the knee out to the side. If you're seated, you can do the same thing. Come up on the ball of the foot. Drop the knee out to the side. So we're kind of getting into that hip complex. We're being sweet. We're being kind. So if you got spicy hip going on, maybe you want to support it with a hand or not. If you want to make it a little bit more range of motion, you would take that yoga block and then place your ball of the foot on the yoga block, and you're at the edge of your chair, and then invite the knee to drop out. Okay? Now, if there's spice, like, ooh, it feels kind of edgy or spicy, what you can do, several things. I invite you to listen to the breath going in through the tips of the nostrils. So breathe in, and then listen to it as it goes out through the nostrils. Sometimes that redirection of the senses allows you to stay in the posture. Sometimes, no, it doesn't work. You got to ease out of the pose a little bit, and then redirect your attention to the breath again. Breathe in. And breathe out. All right, bring that leg back to the center. We're going to do the other side. Now, sometimes when you're lying on your back doing windshield wipers, you might need to have that block underneath because you don't want that leg to go all the way down to the floor. Let's do the other side. Come up on the ball of the foot if you're seated and drop the knee out to the other side. Again, if you want to get a little bit more range of motion, you step on that yoga block on the ball of the foot or the flat foot and bring the knee out to the side. So what you're trying to do here is notice one side versus the other. Does this one feel different, this windshield wiper, when on this side compared to the first side that you did? Notice what you notice or don't notice, and maybe you were thinking, well, I don't know, I wasn't paying attention to that. I was just listening to Gail talk. That's okay too, okay? And then let's invite it back to the center. Again, if it's spicy, return the attention to the breath. Let's do the other side. And again, if you're seated, maybe you're up on the yoga block and you drop that knee out to the side. Sometimes folks want to grab the back of the chair and kind of poof their chest forward a little bit, depending how this feels in the body. Lying on the back, again, you can use that yoga block underneath to keep you from going all the way down to the floor. All right? Now bring the leg back to the center. Let's do the other side. Again, you can do this without the block, by the way, and bring it out to the side. Be tall, maybe hands supporting on the chair if you're doing the chair version today. Typically, I teach this lying on the yoga mat, and I give the verbal cues for the chair, but today I've got spicy knee business going on, and got to do it from the chair today. So if this isn't your cup of tea, you know, join me 2 weeks from now. I'll probably be back to normal then. And then bring the knee back to the center. We're going to do the notice posture. So in the chair, the notice posture is your heels forward. Ooh, feel the tightness of the calf. And then toes up. Now, lying on your back, go ahead and straighten one leg all the way down to the edge of the yoga mat, then the other. Then you're going to notice what's going on with that hip complex, the back of the legs, the back of the knees, and maybe something in the shoulders, the back of the head. So notice what you notice. It's also known as, what else is this known as? Final relaxation posture. But I like to call it the notice pose because I want you to notice what's going on. Okay, belly button tight. Invite one leg back to where the foot's back onto the yoga mat, knee bent, and then the other back to constructive rest posture. Next is going to be pelvic tilt. So I'm trying to think how we're going to cue that on the floor. I'm not sure yet. But those of us seated, let me think about this. You know what? We're not going to do pelvic tilts just yet. We'll do that later on. Okay. Next is knee to chest pose. If you're seated, grab your yoga strap. If you want to do this also with the yoga strap lying on your back, we're going to take that yoga strap along the bottom of the foot. I'm going to scoop my booty back a little bit. And then those of us lying on the floor, invite your knee in towards your chest. Now maybe your hands are on their shin, the hands are back behind the knee. Maybe the strap is along the bottom of the foot. So this is easier to do lying on your back than it is seated in the chair. For me it is. And from here, notice what you notice. So what I want you to notice is, where is that leg? Is it in the hip crease? Is it in the side waist? Is it into the lower ribs? And notice the sensation that's going on here. And then from here, let's point and flex the foot. So we're doing a little ankle mobilization here, a little strengthening, a little range of motion, which is good. Again, the chain of command, so to speak, is, you know, feet, shins, knees, legs, hips, back, shoulders. So if there's something kind of out of whack in any of that, that can cause lots of back pain. And then relax the foot. Now we're going to take the foot and draw a circle inward. So we're going to do ankle circles here. There might be some noise, snap, crackle, pops that happen. Oof, I can feel it in mine. And then reverse. Again, knee to chest, ankle circles, reverse direction now, whether you're lying on your back, whether you're seated on the chair. And then release that foot down. Shake the legs, stomp the feet, shake the legs in, stomp the feet again, and let's do the other side. Again, if you want to do the strap along the bottom of the foot, invite the knee into the chest. So what you're trying to notice on this side, you're comparing it to the first side. How does this feel in your body? Is it spicy in that hip musculature? Is there some challenges going on? Is it into that hip crease, the side waist? Is it into the low ribs? It may be different one side versus the other, especially if you have scoliosis. Because if you have scoliosis and a shifting of the spine and twist, one side is deeply held versus the other, typically. All right, so again, let's point and flex. Oof. And if you need to have your foot closer to the floor, that works too, all right? Just know, do what you can with what you got today. And again, you're noticing left side versus right, right side versus left. Is there any difference? Well, how does it feel different? Not that there's a bad or wrong answer to any of that, okay? And then let the foot be still. I'm going to do that circle in towards the center. Ankle circle, ooh, towards it. My ankle made a big old snap right there, okay? Whew. And let's reverse. Why is it when you do reverse, it feels different? Well, mine does, okay? Mine doesn't feel like a circle anymore. It feels like an oval. At least on this one it does. I had a big old sprain on this one, so that kind of makes sense, you know, all my scar tissue, yeah? And release. Again, let's kind of stomp those feet a little bit. And if you can, come up on the balls of the feet and wiggle. Oh my gosh, the cat's coming into the room. Oh well, we may have a visitor today. And release. Very good. Next is a big toe hold. Now I'm going to scoot my yoga chair back a little bit. And you'll need the strap on this one if you have a strap or that long tie or, you know, the looped bands. And we're going to put the strap along the bottom of the foot and then bring the leg up into the air. Now, those of us that are seated, you're resting the back of the heel and it's toes towards the sky. So those of us lying on our backs, kind of see where it feels okay for you. Is it more away from the body? Is it more towards the body? And it's a softly straightened leg. You should be feeling this in the hamstring, back of the leg, and the calf. Now, to make this bone building, what we're going to do with that strap is we're going to pull on that strap. And then maybe what I like to do is bend the knee and then push the foot away. So it's a very dynamic contraction energy happening here. You're pushing and pulling. Now, for some of us that have some gripping challenges, you may want to take the strap, your hands up the strap a little bit, and then wrap your wrist and then re-engage in that pull-push. So this is one of the 12 yoga postures for building bones. It's a study that was done by Dr. Lauren Fishman out of New York City. He's also a yoga teacher and a doctor. And he came up with these 12 postures, and he proved this with the gold standard, the DEXA scan. We did DEXA scans at the beginning of our practice, and then we did these postures, holding them as vigorously as we could at that time, right? And then after, I don't remember how long it was, then you do a DEXA scan afterwards and some blood work too, to see if there was increase in your bones. In other words, smaller porosity in the bones. So when you contract your big muscles, it stimulates bone growth. This also is related to our back pain also, okay? Now, we got to hold it at least 30 seconds to a minute, 12 seconds to get that bone building benefit. So it's a good thing or a bad thing. I don't know. And then we're going to take this big toe hold with the strap. We're going to shift it out to the side, okay? Now, for those of us seated, you're just bringing it out to the side. Pull, push, re-engage. You're going to feel this in your forearms, maybe your upper back, because you're really engaging the upper body into this pull-push sensation. Now, when I do this on the floor, I kind of take that other leg and kind of bring it out to the side like a counterweight. So you may want to do that too, because you don't want that opposite hip to roll up off the ground when you're doing this lying on your back. So we keep both buns on the chair, on the yoga mat when we do big toe hold out to the side. When you start to have that opposite hip, that opposite side body start to roll off the floor, that means you've gone a little too far, okay? Bring it back to a position where, you know, the shoulders, the hips, the high hips, the low hips can rest on the ground. And of course, you're sitting here on the chair. Feels a little spicy on the chair though, on those sitting bones, just a little bit. And if you need to take a break, please do so. But please don't, because we want to do the bone building, okay? Woo! And release. Bring it back to the center and kind of stomp and shake those feet out. All right, let's do the other side. So switch it into the other foot. Switch that strap into the other foot, and the leg is extended, all right? And pull, push into that strap. Again, you may want to take the other leg out to the side. You're again noticing where it feels comfortable to you. Is it far away? Is it straight up? Is it more towards you for your big toe hold? And again, don't forget, pull, push into that strap. It should feel like a bunch of contracted energy, if that makes any sense. Like, I don't know, like you're holding something very tight, very firm. I'm feeling it in the back of the leg, in that calf, in my behind, where the back of the leg inserts into my glute muscle. Sometimes what you can do also is bend the knee a little bit if it's too much for the back of the knee, but you're still vigorously pulling, pushing that strap. Yeah? Woo! Now, are your forearms engaged in this one? That's what I want to know. Do you feel it in your forearms? Yes, no? Maybe? I don't know if I think hopefully there's not a frozen screen going on here. I'm looking at the everybody else in the room. It seems like there's a frozen screen. I'm just going to assume y'all are doing it okay. All right, now we're going to shift that out to the side. Again, you can use that opposite leg as a counterweight. I'm going to bring it out to the side, pull, push into that strap. Again, we're trying to get that bone building benefit. Oh, you know, that block has hit me. I need to move that block a little bit. I don't want to have that be on the back side of my body. Again, we're getting into the nooks and crannies of that hip socket with this one and contracting the hamstrings, the quadriceps, the calves, the muscles in the bottoms of the feet, some stuff in the hip musculature to encourage bone building in this posture. But again, we got to hold it, hold it, hold it to keep that bone building capacity going on. And again, if it's spicy, return your attention back to that breath. In fact, let's everybody breathe in and breathe out. Again, breathing in, breathing out. One more time. Pull, push, breathe in and out and release. Woo! Bring it back to the center. Kind of shake those feet, wiggle those legs. Very good. That was big toe hold in the front and then out to the side for building the bones with the yoga strap. I'm going to place that yoga strap out to the side here. From here, we're going to do what's called the piriformis bounce. So if you're seated, this might be where you cross the ankle over the ankle, depending on, you know, what you're able to do today. Now, if you're seated, you may want to take that strap underneath the back of the knee, because what the bounce part is you're pulling it towards you and letting it drop, okay? So you got to be near the edge of your chair to make that happen. Now, some folks, whether you're lying on your back or seated, can bring the leg up on top of the thigh. And if that's happening, you're probably already feeling lots of stuff going on in that hip musculature if you're seated. For those of us laying on the floor, you can take your yoga block and kind of bounce the leg away. Now, there's not much give going on here seated on the chair. So again, I try to pull it towards me and let it drop. So why are we doing this? So the piriformis muscle, the sciatic nerve, often is entrapped in the piriformis muscle or alongside it, or that sciatic nerve is kind of pinched in the pelvic notch or somewhere in your spine, okay, which can cause the tingling feeling, the pain, the numbness, and it can go from one side over to the other because the sciatic nerve splits and goes down each leg, yeah? So we're warming up the muscle first before we work it out. Very good. Now we're going to be nice and still. We're going to take the bottom foot, whether you're lying on your back or seated, we're going to tap that bottom foot. So tap, tap, tap the bottom foot and press that bottom foot firm into the floor. So the bottom leg is contracted. Take the top leg, whether you're seated or lying on your back, point the toe towards your knee so your calf is engaged, all the ligaments around your knee is engaged. And then if you're lying on your back, you're going to squeeze both bones and then take that yoga block or hand and push that top leg away as you're firmly pressing into the floor. If you're seated, hands on your legs, tall, tall, tall posture, and hinge forward just a little bit. It's going to be spicy. Don't worry, you're going to feel this one. Again, seated pigeon or reclined pigeon on the couch or on the floor. Let's breathe, okay? Inhaling and exhaling. Again, breathing in and breathing out. Woo! One more if you can stand it. Here we go. Breathe in and breathe out. And then come out of the posture. Relax the foot, relax the leg, go back to bouncing it, wiggling it. Let that piriformis muscle kind of get reactivated. And then take the leg off that leg and kind of shake that leg, whether it's in the air or on the floor. Wiggle it side to side, shake the leg, and then bring it back. Very good. Let's do a windshield wiper in between, shall we? So come up on the balls of the feet. If you're seated, maybe hands on the chair. Drop one knee out to the side. And if you're lying on your back, drop one knee out to the side. Notice how this feels a little different now since we've done a couple of postures. And invite the leg back to the center. Let's do the other side. So drop the other knee out to the other side. So this is kind of like a giving yourself a little break between piriformis bounce and pigeon on the other side. And bring it back to the center. Very good. Kind of stomp those feet. Wiggle those legs. Let's do the other side. Again, if you're seated, you may want to get that strap handy. And we're going to cross either at the ankle bone and the knee is out to the side. Again, I'm teaching the chair version of this class today because I got a spicy knee challenge going on, but I'm also giving the verbal cues for lying on your back. Or, if it's available, leg on top of the thigh. Make sure that ankle's past the thigh because sometimes that gets kind of knobby on the leg. And we're pulling it towards us and let it release. Or, you're lying on your back, maybe the hand, you can bounce it away or take that yoga block and bounce it away. Don't go towards ouch. Not today, okay? So yeah, I'm going to have my hand on my leg and just kind of wiggle it a little bit here. Again, piriformis bounce before we go into reclined pigeon or seated pigeon on the chair. Very good, very good. All right, so now what we're going to do, we're going to take that bottom foot and tap that bottom foot, tap, 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 or heel up if you're seated on the chair, and then press that bottom foot firm into the ground. So you're activating the bottom leg, the leg on the bottom side. Now, squeeze both bones, take your top toes, point them towards your knee, sit up tall if you're doing this seated, and if you're lying on your back, squeeze both bones, take that yoga block or hand, push that top leg away as you vigorously push into the floor. You're seated, hands on the knee, hands on the foot, elbows out, hinge forward. Woo! There might be a little spice going on. This one's typically held a little bit more spicy seated on the chair because you're kind of working gravity differently, okay? Your behind is the mechanism that's kind of getting all the brunt of the work here. Lying on your back, it's not as spicy, and so you just kind of compare it for yourself, okay? And again, let's breathe while we're here. Inhaling, don't forget, press into the bottom foot. I always forget that. I imagine you do too. And exhale. Again, breathe in and exhaling. Press, press, press. Firm, firm, firm. And one more time. Breathe in and exhale. Come out of the posture. Wiggle the leg a little bit. Let the foot relax. Take the leg up and off. Go ahead and kind of shake. Wiggle that leg. Go ahead and shake and bounce both legs. Shake it side to side. Stomp those feet. Beautiful. Okay. Let's do the notice pose while we're here. So again, extend one leg all the way down to the edge of the yoga mat. And you're on the back of the heel if you're doing the seated version. And do the other one. And just notice if you notice anything different going on with the back side of the body. Whew, maybe, maybe not. Okay, very good. Bringing your legs back to feet on the yoga mat, knees bent. If you're seated, if you're lying on your back, grab your yoga block or that ball, or maybe it's knees together if you don't have that piece of gear today. You take the medium width of the block and place it in between the legs, and then you're going to heel toe your feet in to where you feel that little inner thigh contraction going on. Okay, so this is part of our postures we do for easing back pain. One of the things we do is, I'm showing you my hands, like my hands are spread out wide. We're going to take the fingers and fold them into the pads of the hands. This is called the golfer's grip. So I have the top of the hand aligned with my forearm, so I don't go around with cocked wrists here. And again, what we're going to do is have the hands be out in front of us as if we're flying through the air. And I can't quite get that one finger down, but you know, it is what it is. And then, whether you're lying on your back, whether you're seated here on the chair, bend the elbows to where the back of the arms are going to lay on the floor. If you're here seated, it's like parallel forearms down to the yoga mat. and you look like a half of a letter T if someone was looking at you, or from the top or from forward if you're seated on a chair. Now, what we're going to do here is squeeze the shoulders towards the spine or press the upper back into the floor. So keep a constant squeeze going on with that yoga block. So here we go. Squeeze and release. Squeeze and release. Squeeze and release. Two more. Squeeze and release. One more. Squeeze and release. Now take the hands in front of you, in front of your chest. Clap the hands and rub some circulation back into the hands. This is called letter T arms overhead extension with the yoga block. So we're doing bilateral movements here. So we're going to take the hands, interlace them in front of your chest, and then those of you lying on your back, make sure the shoulders are down on the yoga mat, okay? And make sure your elbows look the same. Typically my right elbow likes to turn out, so I'm always like, okay, turn it back in. With straightened arms, squeezy block, core engaged. Let's bring the arms up and overhead. Go where you can at this moment. Don't forget to breathe. Now, belly button tight. Slowly bring the hands back in front of your chest. Very good. Very good. Okay, now release the hands and go back to that golfer's grip. So fold those fingers, line up the top of the hands with the forearms, and then thumbs towards the center, bend the elbows. All right, we're going to squeeze the upper back, the shoulders towards the spine 5 times. So here, and again, keep a constant squeeze here with the block. It's not like super tight, but there's definitely, you notice it going on, okay? So here we go. Squeeze and release. Squeeze and release. Squeeze and release. 2 more. Squeeze and release. 1 more. Here we go. Here we go. Squeeze, 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 and release. Clap the hands in front of your chest. Woo! Rub those hands, get some circulation going back on. Yeah? And once again, interlace the fingers, look at the elbows, drop the shoulders, palms are squeezing. Squeezing the block, belly button tight, bring the arms up and overhead. And notice if your range of motion has changed a little bit. Now I'm here on the side of my glasses. Woo! Notice what you notice. Squeeze that block, belly button tight. Now, belly button tight. Slowly bring the hands slowly back to chest level. Once they're there, release the fingers, clap the hands. Woo! Rub some circulation back on in. This is our last set. You know what? Grab your yoga block, release it, and then put it back in. Just to kind of give you a little change there, all right? All right, we're going to go back to golfer's grip. Fold those fingers, parallel, top of the hands aligned with the forearms and thumbs towards the center. Now bend the elbows. Here we go. Back of the arms, squeeze these shoulders. I'm going to walk my feet in a little bit to keep that squeeze going on. So here we go. Squeeze into the floor, in towards the spine, and release. Squeeze and release. Again, squeeze and release. 2 more, 2 more. Squeeze and release. Squeeze and release. Woo! Clap the hands in front of your chest. Do that again. Very good. Rub some circulation going on. I love it. Interlace the fingers, squeezy palms, elbows the same, drop the shoulders, belly button tight. Here we go. Up and overhead. Go slow. Don't go fast. Woo. And sometimes folks can wiggle their thumbs and they're touching the floor back behind them. Well, I'm not doing that because I'm seated in the chair. But I definitely notice range of motion difference. Very slowly, belly button tight. Slowly, I say slowly. Bring it back to in front of your chest. Release the interlace of the fingers. Clap the hands. Take the block out. Rub some circulation back into the body. Back into the hands, all right? And then, you know what? Let's take a knee into the chest. And then release that foot back down to the floor. Take the other knee into the chest. And release it back down. Now, if you're on your back, maybe you can take both knees into the chest and do those knee circles. Those of us that are seated, feet wide, and we're going to lead with the shoulders instead. Okay, so again, kind of getting a little motion going on here with the pelvic bowl, with either the seated shoulder circles or knees into the chest and doing knee circles. Now let's go the other direction. Here we go. Very good. Nice. Okay, and come back to the center. Very good. If you brought your feet out, bring them back in. So those of you lying on your back, let's come over and roll over onto your side. Be sweet, be slow. And then take that hand that's in front of you, push up to a seated place. So maybe you're doing that crisscross legs once you get upright. Sometimes we can feel dizzy when we come up off the floor. So everybody, I invite you, hands at heart center, drop your chin towards your chest, get a nice little upper back stretch going on here as we kind of get our equilibrium all nice and stable here. Very good. And then come up to where our eyes are gazing forward. So now we'll do our pelvic tilt. So we're going to do a seated cat-cow, whether you're on the floor, whether you're seated on the chair, or if you know how to do the hands and knees one. I'm not going to verbally cue that one, but we'll cue the one seated on our behind. So our hands are on our legs, and we're in seated mountain pose to begin with. So nice tall posture, ears over the shoulders, shoulders over the hips. Sometimes we have a block underneath one knee because maybe one knee's like super high than the other or super tight in the hip musculature. We do what we can, all right? So from here, we're going to start with the forward fold or the cow version of the pose. So your hands are on your legs and you bend your elbows out to the side and you hinge forward. Now, a lot of times in back yoga or in regular yoga classes, they say drop your chin towards your chest or take your chin towards the ceiling. We don't do that in back yoga. We keep the ears aligned with the tops of the shoulders so that it's a whole unit that's hinging forward. So we're not trying to have excessive curvature of the low back, of the upper back here at the cervical spine or in the sacrum, okay? Kyphosis, lordosis. Now, from here, come back up to a tall posture. Now, this is where it sometimes gets spicy for those of us that are sitting on our behind. We're going to do cat posture, so we're going to do this really slow, okay? So again, hands on the knees, and you're going to kind of scoop out your belly button, contract your belly, and then curve your spine to the back of the room. And again, we're keeping our eyeballs looking forward here. Again, we're not trying to look up, look down towards our chest. So you kind of feel your muscles peeling away from your mid-spine. Very slowly, the pelvic tilt part sometimes gets spicy here. You're going to come out of that curved spine and back up to a tall place. Go slow if you're feeling spice. So I usually feel spice in this one on that left side. So I go slow on that one, okay? Now, let's do this with the breath. First, we're going to breathe in, belly out. And as we exhale, contract that belly button, hinge forward for your cow, your forward fold. Stay here, breathe in, belly big. Contract that belly button, go back to tall seated mountain. Very nice, very nice. Stay here, breathe in, belly big. Now, go to the back of the room. Curve your spine. There you go, seated cat posture. Stay here, breathe in, belly big. Now, contract that belly button very slowly. Come back up to seated mountain pose. Very nice, okay. Let's just go ahead and kind of shoulder shrug right here. This is also called the shoulder shrug for lymphatic drainage. So up and down, up and down. Very good. And we're going to do the big six right here before we move on. So we're going to take our hands and come across above and below our collarbone. So stroke across. This is to help us get rid of that waste that is in our body held in those lymph nodes. Cellular waste. You can also tap across. Very good. It's also called the big six. You can look that up later. Let's do the other side. Stroke across above and below the collarbone. Notice if it feels tender there, okay? It might. You may have lots of inflammation going on. Very good. Next, we're going to do the thymus thump. So we're going to take the pads of our fingers and tap here at the sternum. Just kind of go up and down. We're trying to increase T cell production, trying to boost our immunity. We often kind of lose this after the age of 30. So by physically stimulating this area, we're trying to get those lymphocytes to be increased, those T cells. All right, next is we're going to take our hands, spread them out. If you can do Spock hands, that's cool. Or maybe you just do fingers in front of your ears and back behind your ears. And then you stroke down the side of the jaw, in front and back of the ears, and you stroke down the side of the neck. Then you try to get fingers back here at the back of the head too, because there's lots of lymph in the back of the head also, that occiput. So again, go down the jawline, go down the side of the neck, get those fingers to go back a little bit if you can. So this helps us to get rid of the cellular waste that happens in our brains, to help us lessen dementia, to increase our cerebral spinal fluid flow. Let's do the other side. Again, fingers in front of the ear, back of the ear. Get right back in that bony part, okay? Down the jawline. I'm just kind of spreading my sunscreen around. And down to the side of the neck. Again, I'll put something in the follow-up email that you can, do a little look-see on the Big Six, okay? We do this in our chair Tai Chi class and Qigong classes, the Qigong detox. All right, so next is, if men or women that get breast cancer, they check for, did it move to other lymph node nests, okay? We take the hand, you can do this kind of the right angle of the hand, and you can kind of push in and out. You got the thumb here on the pectorals, you can kind of rub in the pectorals and kind of maybe pat or pound, or just kind of do a rub here in the armpit. Again, we're trying to you have to physically move the waste out of those lymph nodes. Our blood pumps because we have the heart that pumps, but we don't have a pumping mechanism for our lymph nodes in our body. Okay, let's do the other one. Again, you're kind of squeezing here at the pectorals in the armpit. Now, I had that heart surgery almost 2 years ago. And I have scars on the side of my chest because they went in through my ribs. And so I also pat my scars to increase lymphatic flow in those areas. So it's kind of there, by my armpit area. So I just kind of reach down and do that at the same time. Yeah. Okay. So the next one is find the bottom of your ribs. And I got to poke around to find that. And then basically that's kind of where your diaphragm kind of sits right underneath where your bottom of the ribs are, and you kind of stroke at the top, and then you can kind of move it down, or you can just kind of take your hands open or fist and do some percussion, some pounding on your abdominal area. So your gut is considered to be your second brain in your body. If you have maybe some dementia, brain challenges, and maybe you also have some gut issues, because it's also very interrelated. So again, lymphatic drainage by pounding, patting the stomach. Okay, now I'm not sure how y'all are going to do this seated on the floor, but you maybe lean back a little bit. But those of us on the chair, the feet are wide, and where your leg inserts into your torso, you're going to take the sides of your hands and chop what they call the qua, or the inguinal crease. Again, if you have prostate cancer, this is the lymph node nest area they look to see. Did it move into these? Okay, so let's just clear that cellular waste, shall we? Here we go. All right, if you're sitting on your behind on the floor, uncross your legs and have the knees bent, because next is the back of the knees. So we're going to take the fingers back behind the knees, so it's at the bottom of the hamstring, top of the calves, and rub that little crease of the back of the knees. You tend to have swelling in the feet. In the ankles, you need to work back of the knees to make it more effective. Actually, we're trying to get all the stuff from the lower part of the body to drain through that left side back into the heart, out through your body systems. So you got to go from high pressure to low pressure. The low pressure is here at the collarbone. Okay. Very good. Very nice. All right. So next are our warrior postures, okay? So you can do these seated on the chair or standing on the yoga mat. And if you have the chair, you can have the chair in front of you. I'm going to show the seated versions first, but you're going to step your feet out wide, and those of us on the chair, step a leg out to the side, and I'm kind of scooched here at the edge. So sometimes the knees are dropped in. I invite you to have them to look like a letter V or a letter L. We're vigorously pressing into the floor. If you're seated, typically we turn to the center, yeah? So take the torso and bring it out over the leg that's in front, and squeeze the shoulders to where you feel that squeeze with the letter W arms, and extend those arms. If you're doing this standing, the feet are wide. I'm going to bring my chair in front here, and I'm using my chair today, and you turn toes towards that short end of the yoga mat and bend the knee towards the short end of the yoga mat. Whether you're seated, whether you're standing, Press firm into the floor. Again, this is a bone building exercise, by the way. And there's a wrinkle on the floor, and we hate wrinkles. So we're going to press down and away so you can kind of feel it in your hip musculature. Letter W arms, get that upper back strength building going on, and then extend those arms out into a letter T. Squeezy, squeezy. Now, whichever leg you stepped out to the side, whichever knee is bent, you can take your chin and turn your head to look over that bent knee side or that stepped out side for like the traditional version of Warrior 2. We're staying in the pose about 30 seconds, so squeeze those shoulders, press vigorously into the floor, push the feet away. Beautiful. Woo! Maybe hang on to the chair because you're wiggly. I'm wiggly. We're going to move this into reverse warrior. So we're going to do a palm up and reach out a little bit and then bring the arm up into the air. Hand can be on the chair, hand can be on the seat of the chair if you're seated, or hand on the hip or down the leg. This is also a variation of side lateral movement. From here, float the arm down, straighten the leg, bring the knees together if you're seated on the chair, bring your feet back to the center, and we'll do the other side. So step the other leg out to the side, and again, check that letter V going on if you're doing the seated version. Step your feet wide and not heel toe out a little bit more, lift your heel, turn your foot, bend your knee. Very good. Again, there's a wrinkle. Press down, press away to get that activation of that lower body. Letter W arms, shoulders down, but squeeze the shoulders and extend those arms out into that letter T. Again, vigorous feet into the floor. One of our bone building exercises. The Sanskrit name for this one is called Virabhadrasana number 2. I don't know how they say 2 in Sanskrit, but I say 2. You can turn your head to look over that bent knee side as you vigorously press into the floor. You always have the option of hanging onto the chair with one hand, just doing one arm, but make sure it's squeezed. It's contracted upper body energy. So where your pain is not typically where the problem is. It may be a referred pain. So we do upper body strengthening in addition to the lower body strengthening in this back yoga class. Woo! We're going to do a palm up and then reach out and then up into the air for that reverse warrior. Again, hand can be on the chair, hand down the leg. Eyes can look where the hand is, or you can have your eyes look forward. If that makes you dizzy, to look up. Some of us with vertigo, looking where the wall meets the ceiling kind of makes those crystals kind of move around a little bit. It's kind of spicy. Again, do what you can with what you got today, okay? And then float the arm down, straighten the leg, pivot the foot. We're going to go into tree pose next. So I'm going to show the seated version first. Well, actually, I'm going to do the standing version first since I'm already standing. I'm standing beside my chair. I'm going to step a foot out, lift the heel, turn the foot out to the side, and this may be your chair right here. One knee one direction, one knee the other, but I'm going to bend that knee, bring it into the low ankle. Maybe my arm or arms can go up. Now if I'm doing the seated version, I take that yoga block and out here to the side that stepped out. So I have my foot on the block and knee out to the side, feet firm, and at the edge of my chair, pressing vigorously with both feet into the floor to again get that bone building benefit. Breathing in, breathing out, and release. You kind of need to wiggle a little bit, so move side to side because you're kind of holding that pose a bit with that balanced leg. And let's do the other side. So if you're doing the seated version, move that block over to the other side. The foot on the block. Those of us standing, step it out. Lift that heel, turn that foot. You may be able to bring it into the calf, into the inner thigh, but never on that knee joint, okay? So pick a place, and then think about from your pubic bone to your collarbone being nice and lengthy and tall. And you may be having the dance of the foot occurring. Or not. Very good. And release. Next is our 8 movement meditation. So I'm going to demonstrate this seated on the chair, but you can also do this standing. If you're doing this standing, Your feet are about, I don't know, 2 fist distances apart, and your hands out to the side to begin with. Those of us seated, again, we're away from the back of the chair, feet firm onto the floor, and arms out to the side. So coordinating the breath with the movement helps us to lower our stress, which is linked to lowering the cortisol, lowering the belly fat. So let's coordinate the breath with the movement. 8 movement meditation. So palms out, facing forward. Let's inhale, gather the arms in. Exhale, raise them up to shoulder level. Inhale, open up wide. Exhale, bring them back in. Inhale, float them towards our chest. Exhale, push it forward. Inhale, lower back down. Exhale out to the side, palms forward. Let's do that again. Inhale, gather in. Big old breath there. Exhale, raise them up to shoulder height. Inhale, open up wide. Exhale, bring them in. Inhale, float them towards your chest. Exhale, push that forward. Inhale, lower. Exhale, out to the side. Let's do that one more time. Inhale, bring them in, gather them in. Exhale, raise them up. Inhale, open wide. Exhale, float it in. Inhale, float it towards your chest. Exhale, push it forward. Inhaling, lowering. Exhale, out to the side. Let's move this into the chair pose. Inhale, circle, sweep arms up. Bend the knees, bend the elbows. If you're seated, hinge forward, press into the floor. Arms down beside the body. Inhale, circle, sweep arms up. Bend the elbows, bend the knees, sink that booty out. Press firmly into the floor with the feet, whether you're seated, whether you're standing. And again, inhale, circle, sweep arms up. Exhale once more into chair pose. Beautiful. Inhale, circle, sweep arms up. Bring those hands down to heart center. Whether you're standing, whether you're seated, hands to heart center. Let's breathe in, belly big. And then exhale, push the hands one direction, turn the head the other. Stay here, breathe in. Exhale back to the center. Again, breathe in, belly big. Exhale, push it away, turn the head the other direction. Inhaling, stay here. Exhale back to the center. Beautiful. Now, I invite you to come back down to the floor if you're one of these that are doing the mat version of the class. Lie on your back, knees bent. Those of us seated, those of us lying on our back, again, invite a knee into the chest. Notice how this feels once again, if it's more in towards your body or not, how it feels in the musculature. And then release. Let's do the other. Bring the knee into the chest, other side. Compare one side versus the other. And release. Let's do that notice pose. So again, extend the legs, extend the other. Notice how the back side of the body feels. Hopefully it's more in ease with the body, less tension happening. Although, maybe there was a posture that woke the bear. So y'all have to kind of let me know on that, yeah? All right, so this may be where you're going to stay if you're lying on the floor. What I like to do sometimes is take that yoga blanket and roll it up, bring it on the back of the knee. Or I have the feet back onto the yoga mat, and when I'm lying on my back, I drop the knees in. So that way I don't have to hold the position of the knees bent. It just feels kind of natural in the body. Arms can rest on the belly, arms out to the side. If you're in the chair, kind of scoot back in your chair. Get comfortable because we're going to do the guided rest and relaxation practice today. It's kind of like a miniature yoga nidra practice that we provide in the evenings. That's like part 2 for reducing chronic daily pain, is doing a yoga nidra practice. So again, I invite you to get comfortable. Let's redirect our attention to the sensation of breathing in through the nose and out through the nose. Again, when you redirect your attention to listening to the breath going in through the nostril tips and out through the nostril tips, you can't live in the past. You can't think about the future. You're in the present. You're in the now. So that's a technique or a tool you can use to kind of get out of maybe some high anxiety. So again, redirect your attention to the breath. And let's do that once again. Breathe in and breathe out. We're going to do what's called a elongated breath. And I will clap my hands softly for 4 times as we breathe in, expand that belly. We'll pause, and then we'll slowly exhale to a count of 5. I'll clap my hands softly 5 times. And we'll pause at the bottom and then do that a couple of times. So the elongated breath helps you to lower your heart rate, to lower your blood pressure. So if you're in the doctor's office and you're kind of known for high numbers, tell them not to talk to you for just a moment, right? Because they always want to talk to you when they take the blood pressure. And then think about in your brain, maybe look at the floor, close your eyes and breathe in to a count of 4, exhale to a count of 5. So let's practice that together, shall we? We shall. All right, so get a little bit more comfortable. Okay, beautiful. And let's do this. Breathing in and then slowly breathing out. Let's do that again. Breathe in, expand that chest and belly. And slowly, slowly out. Once again, breathe in, belly big. And slowly, slowly out. Good. Let's let go of that. See if you need to further release tension in the body. Maybe, there's a hip or a muscle in the back side of the body that's just kind of grabbing you at the moment. Let's take some imagination here. When we're breathing in, let's just kind of send some healing breathing to that area. Allow it to soften, to release, to let go. So let's just naturally breathe here and just let the tension melt away. Again, breathing in and slowly out. Now I invite you to notice different places in your body. So maybe we're seated here on the chair or lying on the floor. So notice that sensation of support. Notice the back of the legs, the buttocks, the upper, the low back, maybe the back of the head, the back of the heels or the bottoms of the feet. So notice that sensation of support, feeling very weighted, very heavy in the body, as if you were a rock and the earth is holding you up. So again, all those places in the back side of the body are being supported, feeling very weighted and heavy. Good. Now, let's flip that. Let's contrast that to the places in the front part of our body. So notice the hands, the arms, the neck, the face. Maybe you feel air going across the skin. The arms are light. The legs are light. The torso is light, as if you were as light as a feather and you're floating towards the sky. So you're contrasting, comparing all those places in the front side of the body, feeling very light, very feathery, and then contrast that to feeling very supported, very grounded in the places in the back side of the body, feeling very weighted, very supported, very heavy into the earth. And then noticing those places in the front side of the body, feeling very light and feathery, as if, again, you are floating towards the sky. Good. Now, let's return to the present moment. Again, let's notice the breath. Let's pay particular attention as we breathe in through the nose. Notice it going through the nostril tips. Here we go. Breathe in. And then out through the nose. And again, breathing in and breathing out. Let's come back into the now, back into the present moment. So let's just wiggle those fingers, wiggle those feet. If you're lying on your back, maybe you can bring a knee into the chest to release that tension held in that spine. And then lower it back down and do the other knee into the chest. Very good. Maybe both knees can go into a chest and then do those little knee circles. Those of us seated on the chair or on the floor, feet wide, and lead with those wide shoulder circles as we kind of massage the pelvic bowl, whether we're lying on our back or here seated on the chair. Go slow. There might be some spicy areas. And then let's pause and take that the other direction. Here we go. Those wide upper body circles. You may need to hang out in an area that feels a little spicy. You can kind of go back and forth a little bit and then continue in whatever direction you need to go. Very good. Come back to the center. Now, if you're lying on your back, I invite you now to slowly roll over onto your side. You're going to take that top hand, press into the floor, and drag yourself up to that seated place. Now, everybody, once we're upright, hands to your chest, drop that chin towards your chest. Get that nice upper back neck stretch. Again, doing what you can here. Don't press it too far. And then bring the head back to heart center. Place the hands in your lap, and let's drop an ear towards a shoulder. Ooh, I'm feeling stiff on this side. I'm going to bring my hand off my leg to allow it to go a little bit more. Sometimes that helps a little bit. And then bring the head back to heart center. Let's do the other ear towards the shoulder. I first have my hand in my lap, and then I take my hand off my lap to go a little bit deeper into the posture. And then bring the head back to heart center. For here, we're going to turn our head to look over one shoulder. And then if it's available, drop the chin towards the shoulder. And then very slowly roll to the center towards your chest with the chin towards the chest. And then bring the head back to heart center. Now we're going to look over the other shoulder blade. So turn your head over towards the other shoulder. And then drop the chin towards your shoulder. Then very slowly invite it to roll down towards your chest. And then back to heart center. From here, let's do a little hand tapping sequence. And again, we're kind of forward on our chair here a little bit, nice tall posture. We're going to tap the sides of the hands for headache and vertigo reduction, okay? This is your heart meridian also. So we're doing a little sampler here, but you typically do this for about 60 seconds in each place. And now we're not whamping, we're just tapping, okay? Just a soft little tap. Next is the interwebs of the thumbs. This is for digestive disorders, for nausea. So again, we're going to go tapping into that interweb of the hands. You kind of show that there. My elbows are awkwardly up. I'm going to put them down. It feels better down, yeah? And if you've got bracelets on, they're going to make a little sound here. Then you're going to flip it because you got to use both sides of the brain. Feels a little different here. Tap, tap, tap. Then we'll shift to the interwebs of the fingers for pain or numbness in the limb. So you go kind of in between here and tap in those little valleys. Again, if you've got rings, you got to be mindful of that, okay? They may make a lot of noise and they may, be kind of clunky. So be soft, be kind, yeah? Very good. And then wiggle the finger that's on top because you normally interlace your hands a certain way. Switch it, brain work, and continue that tapping. This probably feels strange because you don't normally interlace your hands the second way that you're doing this. You have a default, you have a standard that you adhere to, yeah? Yeah, this feels strange. Then we'll do here at the pulse points. That's for your heart, cardiovascular issues. So tap, tap, tap. You can do it like this, but I like to do it like this because we do a little extra because we flip the hands, yeah? Makes a nice little sound. So again, that's at that pericardium meridian in traditional Chinese medicine. And flip it. Okay, I almost forgot. I got CRS today. Can't remember stuff. You fill in the blank. Then we're going to cup the hand and tap on the top of the hand. So that's for osteoarthritis, back pain. So here we go. Again, we're not whamping, we're just tapping. Some people like to put their hand on their leg and do the tap, but I find that I press a little bit too much when I put the hand on my leg. Well, that was loud. Do the other one. Again, I got a ring on this one, so I got to cup it a little bit more. And when I was on blood thinners, because of my AFib, I would do this a little bit less vigorous, okay? Now we're going to move it to the back of the wrist. That's for neck and shoulder pain. So here we go. Again, you're cupping the hand. You're doing that tap. Then we're going to switch it to the other one. Now I've got my watch on that one, so I'm going to be more on the top of the hand than the back of the wrist. Again, for neck and shoulder pain. Very good. And then one of my favorites is to make a little fist and punch into my palm. For lessening that stress, anxiety, improves clarity, consciousness. Maybe there's somebody's face here. I didn't say that. Or maybe I did. You're going to notice also maybe one side feels more strong than the other. Let's do the other side. So that's my weaker side. I definitely noticed that. Although it's improving a little bit. We still have our gratitude practice to do, folks, before we end class. But we got to do one more thing, which is like a brain teaser, okay? We're going to interlace those fingers, squeezy palms, and then it's kind of like you're drawing a figure 8. Now, this isn't so bad, okay? But this is, you know, again, rest stretches, good for that carpal tunnel. Here's the hard part. Reverse it. Okay. Okay. I cannot do the reverse. I don't know. It's like I have to think too hard to do this. Okay, in reverse. I don't know if y'all have the same kind of challenges there with this reverse wrist circle. Mine's kind of wonky, that's for sure. Okay, and release that. Clap those hands. Rub some heat into those palms. And then from here, you can either stack the wrist upon each other at that heart center, or maybe you prefer hands together. You get to choose here. And we're going to think about one thing, or at least an idea of gratitude. And let's take whatever that is. Let's take our chin in towards our chest, just in gratitude of showing up today. And then whatever we were grateful for, we're grasping that, putting that into our heart space, just for a moment, just for pausing for a moment here. Very good. And you can keep your chin towards your chest, or you can gaze your eyes open or closed forward as I say our traditional sayings to end our class today. So the light in me honors and respects the light in you. So let's take the peace, the strength, and the understanding, and that little attitude of gratitude, and let's pass it on. Namaste, which means the bright light in me honors and respects the bright light in you. This concludes our practice of gentle yoga for back care, with the emphasis today on the seated versions of our back yoga class. Join me 2 weeks from now for more of the floor versions. Thank you all for coming today.